What is exciting about neoadjuvant immunotherapy, meaning giving the immunotherapy before surgery for people with a clinically positive disease, such as enlarged lymph node in one of the lymph node regions, whether it's in the neck, in the armpit, is we are able to evaluate the response. The tumor still is in place. We give the treatment, and then we are able to evaluate whether the patient would respond to this treatment or not. Still the standard of care in the United States is to do a complete lymph node dissection. And then the specimen would be sent to the pathologist. He will look at it and he will tell us, is it a major pathologic response, meaning only 10% of melanoma cells are available, 10% or less? Is it a partial response, meaning between 10 to 50% of melanoma cells are still in the specimen? Or is it no response? More than 50% of melanoma cells are still in that tumor. And that can help in two things. For me as an oncologist, I can counsel the patient. I can tell them, you had a major pathologic response. I mean, the pathologist saw less than 10% of melanoma cell. The immunotherapy is great for you, and most likely you're going to enjoy a recurrence-free and even distant metastatic recurrence-free. You will be free of, hopefully, metastatic disease in the future and free of recurrence. I can reassure the patients that this immunotherapy, when it works, it has a durable response, it works for good. And we have that data, even if we're going to extrapolate the data from the stage 4 disease, we know that people who respond to immunotherapy, they enjoy this long-term remission. That's the beauty of immunotherapy. The second thing is, let's say the patients did not respond, like a person with melanoma did not respond to immunotherapy. And let's say that person has a BRAF mutation. Maybe after the surgery, I would be more tempted to use a targeted therapy rather than using immunotherapy. So it helps me even adjust the treatment after surgery based on the response. So there is a lot of value to gain from this neoadjuvant immunotherapy, let alone the fact that the trials coming from Europe, such as the Prado trial, I mean, it showed the responses are extremely high. I mean, we're talking about 71% of the people having a major response to this treatment. That's phenomenal. I mean, to have a 71%. So, when we give this immunotherapy early on, we're having a lot of responses. Although I have to be, I have to caution you that also the side effects could be higher when we give it early on. Most of the side effects are manageable and really treatable, but